A mission from the CDC about how the coronavirus spreads. In new language posted online, federal officials now say the disease is an airborne threat and not spread through close contact. Joining us now to discuss is Dr. Jonathan BAKTARI, Medical Director and CEO of E7Health.com, a preventative health and wellness company. Doctor, thanks so much for coming on. This new language that's being used by the CDC, acknowledging that this is airborne and not through close contact, was that a surprise to you? And can you explain what that means by not through close contact?
Yeah, so I think that term is somewhat vague, but I think we all understood that airborne transmission was the mode of transmission mainly, predominantly, and it's finally, here. But yeah, I think this is exactly what we all have been thinking and doing with the barrier measures and, trying to ventilate indoor areas better. So this was obviously in line with that.
Okay. What about once they come out with this new language, and as you said, and a lot of us obviously already know that's why we've got to wear these face coverings, that's why we've had social distancing measures in place. But what about the whole hand sanitizing and wiping off this and that? Is there any relief for that in knowing that this is an airborne disease?
That is a small mode of transmission. The preponderance of cases are through aerosolized droplets. I think what really this changes is really looking at indoor ventilation and indoor filtration. I think that really is going to highlight this, because the way people get sick indoors is, for example, the number of time air is exchanged in an indoor room. And as buildings and rooms become more energy efficient, that means less outside air is being exchanged per hour. The recommendation is ideally 6 air exchanges per hour. So now the focus can go to that. Unfortunately, that goes somewhat contrary to, energy efficient buildings. So I think that's going to be the struggle.
Let me talk about the updated public guidance coming here as Dr. Anthony Fauci says face coverings, which we kind of talked about, that could become seasonal now, even after the pandemic. Here's that sound, and I'll get your reaction.
It is conceivable that as we go on a year or two or more from now, that during certain seasonal periods, when you have respiratory-borne viruses like the flu, people might actually elect to wear masks to diminish the likelihood that you'll spread these respiratory-borne diseases.
So you have Dr. Fauci, and then you have President Biden saying he wears masks to protect others, even though he's been fully vaccinated. Right. Here's that.
Why do you choose to wear a mask so often when you're vaccinated and you're around other people who are vaccinated?
Because I'm worried about you. No, it's a joke. It's a joke. Why am I wearing the mask? Because when we're inside, it's still good policy to wear the mask. That's why. When I'm outside, and the problem is, lots of times I walk away from this podium, you notice, I forget to put my mask back on because I'm used to not wearing it outside.
There's a lot to be dissected in that, but I want to say on the medical topic, obviously, of what does it mean for mask wearing in certain Asian cultures? Mask wearing right. is something of a norm. It is not here in America. It hasn't been. We have always been told this is temporary. Now there seems right. to be this hint that maybe this mask is to stay. Do you believe that?
Well, I think some of the Asian cultural preponderance for wearing masks has to do with air pollution and some other things. But yeah, certainly, we have a lot of flu-preventable deaths every year in the United States. So someone can make that argument during flu season. But clearly, when it comes to the COVID pandemic, if you're fully vaccinated, your chances of transmitting it to other people is pretty minimal. So on that ground, that doesn't make a whole lot of sense. If broadly speaking, during flu season, people want to take that extra measure, I could see that. But the real issue is how quickly and firmly we get to herd immunity. Because once we get to herd immunity, the argument for wearing masks, especially if there's no new variants, and especially if our immunity lasts from this vaccine or natural infection, is going to be less convincing.
But there always are new variants, right? I mean, the flu, when you think about the influenza, that continues to
right.
mutate. Isn't that correct?
That's right. It mutates every year, and we get a new vaccine every year, and the vaccine is, 60% efficient. So, and a lot of people die from the flu yearly. So you can make that argument based on general, upper respiratory infections in general, yeah, we certainly have a lot less, flu-related deaths annually if we took even more measures. But as it relates to COVID, I think the struggle is going to be trying to get to herd immunity.
Well, let's talk about that herd immunity. Where's the goalpost for herd immunity?
Yeah, I really think we're steaming fast towards it, and partly because so many Americans have had the natural infection on top of the vaccine, which has given them immunity. Even by CDC guidelines, as of January, they thought 83 million Americans had already been infected, some documented, some not. So when you add that plus all the people who have been vaccinated, as we approach 70, 80%, which should be happening in the next couple of months, when you combine that with people who've already been infected, I think we're getting there fast. The only issue is, are we going to get a variant that these vaccines don't cover, or will our immunity peter out from the vaccine?
But I don't know if and I agree with you, but I don't know if they're let's go by Johns Hopkins and others that are calculating how many have been vaccinated. I don't know if they're also calculating the percentage of folks that have already the natural antibodies that have been infected and that beat COVID. I don't see the chart for that. Why is that?
I can't explain it, because we know by almost any estimate, 1/3 of Americans have been infected naturally. Because if you think for one documented cases, there's 4 undocumented cases, the argument could be made 1/3 of Americans have already been infected. That's essentially like vaccinating 1/3 of Americans even before the vaccine came out. Although we don't know how long the immunity from natural infection versus the vaccine will last. But yes, you should combine them as you're trying to calculate herd immunity.
All right, we'll leave it right there. Very interesting conversation, one that really needs to be had, needs to be having more. Dr. Jonathan BAKTARI, good to see you. Thank you for your time. We appreciate it. Let's get you over now to Rachel Roller, standing